Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS, Certificate Programs, Certificate in Maternal and Child Health Nursing, CMCHN, BNS 117 Maternal and Child Health Care, Block 1 Reproductive Health, Unit 1 Concept of Health and Primary Health CAR, 1.0 Objectives. After completing this unit, you should be able to times explain the changing concepts of health, times define health and state its philosophy, times explain various dimensions and determinants of health, times discuss the requisites of health, times explain the concept of illness and disease, times discuss the web of causation of disease, times explain natural history of disease. Times define and explain the meaning of HFA, times state the basic principles and general strategies of HFA, times enlist the global targets, times state the national strategies as enlisted in National Health Policy, times recall specific goals in respect to indicators, targets of HFA, times highlight the background of primary health care, PHC, as a strategy for HFA by 2000 AD. Times define and explain the meaning of PHC, times explain the principles of PHC, and times discuss the levels of prevention of disease. 1.1 Introduction. You know that health is a state of physical, mental, social, and spiritual well-being, and not merely an absence of disease or infirmity, and health is affected by many factors like heredity, environment, ways of living, socioeconomic status, health, services, etc. Disease is a physiological psychological dysfunction, illness is a subjective state of a person, i.e., the person can describe his condition as not being well and is not able to interact and perform his daily activities. You may have studied in your earlier training that diseases are caused by interaction of agent, host and environment, epidemiological triad, and in many chronic disease, multifactor cause disease. Now you may be interested to know how an individual or community can attain complete mental, physical, and social health. You will find the answer in this unit. We shall try to concentrate on the changing concepts and definitions of health. Various dimensions, i.e., physical, mental, social, and spiritual well-being, and factors which determine the health of an individual like heredity, environment, and lifestyle, etc. You will also learn the concept of illness and disease, the natural history of disease, the process of causation of disease concept, and primary health care and health for all. In the end, you are also being helped to learn about the various levels of prevention of disease which will help you to contribute effectively to achieve positive health. It is also seen that the concept of health changed over time depending upon scientific and socio-economic developments and advancements. Ancient Indian history reveals the practice of comprehensive concept of health. During Vedic period, it emphasized on health promotion and health maintenance through practice of good environmental sanitation and personal rules and regulations. Health also included physical, mental, social, and spiritual aspects of life. However, for the past few decades, there has been a change in the concept of health. Health is considered as a fundamental human right. It is also considered a social goal to be achieved by all to lead economically productive and useful life. This goal is popularly known as Health for All, HFA, which was adopted by WHO in 1977 and accepted by all the member countries. India also adopted this goal of HFA since then. The concept of health also varied among various professional groups, example, medical scientists, social scientists, environmental scientists, etc. This brought about changes in the concept of health. You will now learn about these changing concepts in the following subsections. 1.2.1 Changing concepts of health. You have learnt above that the concept of health is not constant. It is changing from time to time under the influence of continuous changes throughout the world. A brief description of changing concepts of health is given in this subsection. Let us discuss these concepts one by one. I. Biomedical concept. According to this concept, health is viewed as freedom from disease, i.e., individual is considered healthy only if he does not have any disease. It also stresses that ill health is caused by disease-producing organisms. Example, typhoid is caused by Salmonella typhus, cholera by cholera. Vibrio, the human body is considered as a machine and disease occurs due to breakdown of this machine. The doctor's or any other health worker's work is to repair this machine. This concept of health ignored the role of social, environmental, and cultural factors in disease causation. This model was found to be inadequate to solve the problems of malnutrition, chronic diseases like diabetes, peptic ulcer, drug abuse, and accidents. Since these diseases are not caused by disease-producing organisms but by other causative factor e.g., inadequate nutrition, lack of exercise, overexertion, emotional stress, pollutants, etc. 2. Ecological concept. According to this concept, health is viewed as a harmonious relationship between man and his environment, and disease as maladjustment of the man to his environment. There is a continuous adaptation and adjustment of human being to his environment. There is a feeling of well-being, relative absence of pain and discomfort when man is able to adjust with his environment, and feeling of ill health when he is not able to adjust. It means as long as human being follows desirable natural principles of healthful living, they can live healthy and happy life. Once this balance between man and his environment is disturbed, there is maladjustment and it can cause various diseases. For example, industrialization and urbanization, increasing population and overcrowding, transport, etc., have resulted in pollution of air, water, and soil. 3. Psychological concept. According to this concept, health is not only affected by disease-producing organisms, physical environmental conditions, and harmful personal practices but also gets affected by various other factors such as social, psychological, cultural, economical, and political. Therefore, all the factors including biomedical, environmental, and psychosocial, cultural, and economical factors need to be considered while assessing health status of people at any time. 4. Holistic concept. According to this concept, human being is considered as a whole person comprising of body, mind, and soul. He lives under the influence of various factors in his environment, community. These factors include biological, physical, environmental, social, psychological, cultural, economical, and political resources available in the community. These factors influence and determine total health of body, mind, and soul, i.e., physical, mental, social, and spiritual health. This concept emphasized on promotion and maintenance of health. Hence, holistic concept of health is also known as comprehensive concept. 1.2.2 Definitions of health. You have learnt about the various concepts of health. Health is viewed and interpreted differently by different people depending upon their background. The concept of health changes based on the experiences and scientific developments and advancements. Accordingly, there are a number of definitions. A few definitions based on the changing health concepts are given below. State of freedom from pain, illness, and disabilities based on biomedical concept. The condition of being sound in body, mind, or spirit, and especially freedom from physical disease or pain based on psychological concept. Relative state of freedom from pain and discomfort and continuous adaptation and adjustments to the environment to ensure optimal functioning based on ecological concept. A sound mind in a sound body, in a sound family, in a sound community, environment, based on holistic concept. WHO states the definition, which is very popular, comprehensive, and accepted universally in 1994 as under. This definition reflects holistic view because it recognizes well-being of an individual as a whole. This definition indicates positive health because it refers to complete state of well-being and not only the absence of disease. It means that every organ and system in the body functions normally and the body is able to perform all the functions normally. The individual is able to adjust with himself and with others and with his environment, etc. 1.2-3 Philosophy of health. Philosophy of health refers to our knowledge, beliefs and feelings about health. From the above discussions about health concepts, the following philosophy can be derived. Health is essential for every individual to have useful and quality life is, therefore considered as a basic human right. 2. Health is something which is to be earned. It cannot be gifted by anyone, therefore, individual, family and community have to get involved and take responsibility at their own level to promote, protect and maintain their health. The state government needs to support people by providing health-related services. 3. Health is an essential element of productive life. Because without being healthy, the individual will not be able to perform daily activities, concentrate, and put in required time and efforts to work and earn. 4. Health is part and parcel of national development because healthy people can contribute to overall developments of the nation and this overall development in return can promote health of people. Health is a social goal, i.e., goal to be achieved by all, by the joint efforts of individual, family and community. 1.2.4 Spectrum of health. Health of any individual is not constant. It changes every now and then, i.e., it fluctuates under the influence of factors from within the individual and his environment. The change from optimum health to ill health is often gradual. And where one state ends another begins is a matter of close observation. It means health of an individual fluctuates within a range of optimal health at one end to severe illness and death at the other end as shown in Fig.I. This refers to spectrum or continuum of health. Hence, the lowest point on the health disease spectrum is death and highest point is positive health. Person may function at maximum level of health today and diminished levels of health tomorrow. It means that health is a state not to be attained once and for all, but ever to be renewed. There are degrees or levels of health as there are degrees or severity of illness. 1.2-5 Dimensions of health. The dimension of health refers to various aspects of health. Accordingly to WHO definition of health, there are 4 dimensions related to body, mind, soul and social well-being. These are physical, mental, emotional, social and spiritual dimensions of health as shown in Fig. 1.2 Fig. 1.2 Dimensions of health. You will now learn about these dimensions which are discussed below. Physical health. Physical health well-being is related to body. It refers to normal functioning of all the organs and systems resulting in harmonious functioning of the body. Some of the characteristics of physically healthy individual include bright complexion, clean and firm skin, bright and clear eyes, lustrous hair, good body posture, clear and healthy mouth and teeth, normal vital signs, normal body weight, good appetite, sound sleep, regular movements of bowel and bladder and coordinated bodily movements. The physical health can be assessed by times self-assessment of overall health, times general observations, times clinical examination, times nutrition and dietary assessment, times biochemical and laboratory investigations. At the community level, the state of health can be assessed by knowing death rate, infant mortality rate, and expectancy of life at birth. 2. Mental health. Mental health is related to mind. It refers to normal functioning of mind and not merely the absence of mental illness. The individual said to be mentally healthy if he/she is able to make harmonious adjustments with himself/herself, with others and with her surroundings, and leads a happy, useful, and purposeful life. The characteristics of mentally healthy individual are: the individual knows himself, his strengths and weaknesses, and accepts them. He knows his needs, problems, goals, and tries to fulfill them, solves problems, and is at peace with himself. He is free from tensions, he lives for his identity, has self-confidence and sense of self-esteem. He has good control over his emotions, he accepts others, gets along with them, establishes harmonious relationship with people and the environment. Mental health and physical health are interdependent. Poor mental health affects physical health and poor physical health affects mental health. For example, conflicts, anxiety, worries may cause peptic ulcer, diabetes, obesity. Any physical illness may lead to anxiety, depression, etc. It is difficult to assess mental health. Some tests and questionnaires have been developed to assess mental health of people. 3. Social health. Social health is related to social self of an individual. It refers to socialization of an individual in the context of existing social structure. The individual is said to be socially healthy when he/she is able to socialize normally with his family, neighbor, friends, and establish healthy, lasting, and satisfying relationships with them, accepts social culture, ethics, and value system of a community in which he/she is living, contributes in modifying socio-cultural behavior that affects health and quality of life, regulates his/her socio-economic conditions to satisfy material needs, and leads wholesome life. If an individual is not socially healthy, it affects his/her mental and physical health due to poor, unhealthy socio-cultural practices and conditions, and vice versa. 4. Spiritual health. Spiritual health is related to soul or spirit of a person. It refers to individuals' faith in supernatural power and religious aspects which regulate life and affect health. The individual is said to be spiritually healthy when he/she has faith and beliefs in supernatural power, respects ethical values, principles, and practices them in day-to-day life, maintains integrity, understands meaning of life and leads a purposeful life, remains contentful and faces realities of life gracefully, respects and regards religious feelings and practices of others. Spiritual values and practices influence our physical, mental, emotional, and social behaviors, health, and well-being. For example, meditations, religious discourses help to keep mind free from worries and stresses of daily life, etc. To sum up, we can say that individual functions as a whole with all the health dimensions related to each other and affecting each other. It further strengthens the concept of positive health. All these concepts related to the dimensions of health introduce us to the concept of positive health. 1.2.6 Determinants of health. The health of an individual may be affected by various factors. Health of an individual depends upon a number of factors. The factors which influence health lie both within the individual and externally in the society in which he or she lives, or two sets of factors: genetic factors and the environmental factors. Those factors interacts, and these interactions may promote or deteriorates health. The factors within the individual and the factors within the society are as follows. Heredity. 2. Environment. Fig. 1.4 Determinants of health. Now we shall discuss these determinants of health in detail. Heredity. Heredity refers to transmission of physical and mental characteristics from parents to their children. Example: general appearance, height, weight, natural immunity, intelligence, etc. These characteristics are passed on through genes present on chromosomes in cell nucleus. These inherited characteristics will determine individual's physique and mental constitution as he grows and develops while in womb and after birth under the influence of environmental factors. 2. Environment. Environment refers to surroundings in which the person lives. Till the fetus is born, it grows and develops within the environment surrounding mother's womb. The health of fetus is influenced by mother's general health, nutrition, and illness, etc. As the fetus comes out of his mother's womb, he is exposed to all the things in his external surroundings, i.e., environment in which he continues to live, grow, and develop. The environment has three components. These are times physical, times biological, times psychosocial cultural. Each of these components has direct effect on physical, mental, and social health of each tilde man being. All the three components are closely related to each other. A. Physical environment. Physical environment includes housing and building structures, air, water, food, soil, light, sound, heat, humidity, solar energy, and waste material, etc. All these aspects of physical environment either promote health or may cause any specific disease. For example, dark and dingy house may cause retarded growth in children, may expose anyone to the risk of tuberculosis. Lack of sanitation, unsafe water, and contaminated food may cause disease like typhoid, diarrhea, dysentery, hepatitis, and leads to mosquito breeding, etc. Though lot of improvement is done in the physical environment, example planned construction of cities, towns, houses with basic amenities, proper disposal of sewage, refuse and excreta, safe water supply, pasteurization of milk, etc. But it still continues to be health problem in our country because of large and scattered population, especially in tribal and rural areas, poor socio-economic conditions, urbanization and modernization. It is very important to maintain safe physical environment. Efforts must be put in by individual and family to improve their immediate environment. B. Biological environment. This includes all living things surrounding man, example viruses, bacteria, insects, rodents, animals and plants, etc. These may act as disease-producing agents, reservoirs or host and vectors of disease in their interaction with man. Example malaria, plague by insects and rodents. C. Psychological environment. Psychological environment refers to people who live in social institutions like family, neighborhood, school, workplace, community, etc., and their psychosocial and socio-cultural practices. This implies that man is a member of these groups and interacts with them, learns about psychosocial and socio-cultural practices. He tries to adjust and develop harmonious relationship with them. Thus, tries to attain positive mental and social health. But not all the psychosocial situations and practices have positive impact. Example, broken families, single-parent families, large families, illiteracy and ignorance, early marriage, polygamy, purda system, women's status etc. All the three components of environment are interrelated and environment is considered as a whole in identifying its effect on health. The healthy environment can help people develop their physical and mental capabilities. 3. Lifestyle. Lifestyle refers to the ways of living of the people. It includes daily living activities, cultural practices including customs and tradition, and personal habits. Healthy lifestyle promotes positive health. Poor lifestyle has ill effects on health. For example, good personal hygiene, adequate nutrition and safe dietary practices, adequate education and suitable work, and self-care promote health. Whereas unhygienic practices may cause scabies, worm infestation, trachoma, etc. Defective dietary practices may cause malnutrition and deficiency disease. Smoking, alcoholism, inactive life may cause cardiovascular disease, diabetes, cancer, etc. 4. Socioeconomic conditions. Socioeconomic conditions include economic status, education, occupation, and political system. Developments in socioeconomic status improves living standard and results in reducing death rates, disease rates, and increase longevity. An overview of these socioeconomic conditions is given below. A. Economic status. It implies the amount of money the individual family has to spend to fulfill daily requirements. It is determined by per capita income per month. The more the monthly income, the more will be the purchasing power, i.e., individual and family will be able to purchase various things for daily living and avail health care services, etc. This will improve their living standard, life, and thereby health and well being. But too much of money may lead to some bad habits, example, excessive drinking and smoking, overnutrition and poor dietary habits, etc., which may result in cardiovascular disease, obesity and diabetes, etc. B. Education. Education is very important factor. It makes the individual knowledgeable and he overcomes his ignorance about various aspects of life. It helps him to make right choices about daily living activities, lifestyle, occupation, self and family care during death and sickness. Thus, it helps promote health and quality living and reduces morbidity and mortality rates. C. Occupation. A suitable, productive, and paying occupation is very important for every adult individual to promote his her comprehensive health. It not only gives money power but keeps the individual busy in constructive and useful work. He gains sense of achievement and self-identity. D. Political system. The political system plays an important role in improving health status of people because political will and decisions determine the national health policy, health care delivery system, infrastructure and accessibility and availability of health services, allocation of funds and development of manpower which contribute in promoting health, preventing disease and preserving life of people. In conclusion, we can say that health status of an individual, family, community and nations is affected by their overall socio-economic status, which needs to be considered. Health and family welfare services. The purpose of health and family welfare services is to promote and improve the health status of the population, prevent disease and prolong life. For example, immunization to children can reduce the incidence of communicable diseases in them. Maternal and child health services can reduce the morbidity and mortality rate in mothers and children and promote their health. Therefore, health services are essential to improve the health of the people, provided the people avail these services. 6. Other factors. These are health-related systems, i.e., food and agriculture, education, industry, and social welfare and socio-economic policies regarding employment, wages, medical insurance, family support system, etc. All these would help in improving living standard, health and well-being. 1.2.7 Essentials of Optimum Health. Having learnt about the determinants of health, let us discuss the requisites of optimum health, which could be identified at 3 levels: I. Individual and family level, 2. Community level, 3. State level. I. At individual level and family level. The requirements of health at the individual and family level include times following of personal hygiene practices, care of body parts, cleanliness, times taking enough rest, sleep, exercises and recreation, times well-balanced diet, times regular health screening and immunization, times reporting early when sick and taking regular treatment, times avoidance of unhealthy practices, overeating, smoking, drug abuse, etc. Times maintaining good social relationship and working condition in the family and workplace, neighborhood and community people. 2. At community level, requisites of health at the community level include times proper housing and sanitation, times safe water supply, times clean air, proper light and sound, times safe surroundings to avoid accidents, times proper disposal of excreta, refuse waste water and sewage, times good placement of school, health centers, hospital, market and recreation facilities, times removal of harmful vectors, times plantation and vegetation, growing more trees, green belts and encouraging kitchen gardens, times good social relationship among the neighborhood and community participation. 4. At state level, requisite of optimum health care at the state level includes times political will and desire to implement health care, policies, times desired healthcare delivery system, times adequate and accessible infrastructure, times desired manpower development, times adequate and desired health-related services which include nutrition, environmental sanitation, education, right to work, etc., times maintenance of health records, reports and health statistics, times evaluation of healthcare services and feedback, times research. 1.3 Concept of illness and disease. You have already learnt about the concept of health, dimensions of health, determinants of health, and the essentials of good health. Now let us learn about the concept of illness, sickness, and disease. All these concepts are related to each other, but these are not synonymous, similar. 1.3.1 Concept of disease. The literal meaning of the term disease, i.e., disease, is without ease or uneasiness. According to Oxford Dictionary, disease is defined as condition in which the body, some part or organ of the body, is impaired and does not function normally. In other words, disease is defined as departure, deviation from complete state of health and well-being, which includes physical, mental, social, and spiritual aspects. 1.3.2 Concept of disease causation. Before 10th century, occurrence of any disease was considered to be the curse of God or evil spiritual bad air. In 19th century, disease-producing microorganisms were discovered. It was found that every single disease was caused by one specific organism. Disease agent: example, cholera due to cholera vibrio, tuberculosis due to tuberculosis bacterium, etc. This refers to one-to-one relationship between causative organism and the disease as shown in the schematic model below. This concept of disease causation is popularly known as germ therapy. Biomedical concept of health discussed in subsection 1.2.1 stresses on germ theory, but this theory has many limitations. The disease is rarely caused by single disease agent. It depends on number of other factors related to the man, i.e., host and his environment. For example, everyone exposed to disease germs does not get the disease, example tuberculosis, unless the host is undernourished, susceptible to get the disease, and lives under unhygienic conditions, i.e., environment which contributes to causation of tuberculosis. Disease is caused only when there is an interaction of agent, host and environment, as shown in Fig.L.6 above. It means disease will occur only if the host is weak, the agent is strong and enters the host through right channel and in sufficient amount, and when the environment conditions facilitate the interaction of host and agent, example poor environmental sanitation, malnutrition of a child, and contaminated water can cause diarrhea. This model implies that disease will not occur without sufficient interaction of these three factors and will remain in balanced state. This is called as state of health equilibrium. 1.3.3 Web of disease causation. The model shown in Fig. 1.13 is ideally suited to study the chronic disease, where the specific disease agent, causative organism, is not known, but disease occurs due to interaction of multiple factors related to lifestyle, human behavior, and environmental conditions. This model suggests variety of interventions like avoidance of smoking, diet control, exercises and regular checkups in cardiovascular disease, etc. Fig.1.13. The Web of causation for myocardial infarction, adapted from Leigh Park, Textbook of Preventive and Social Medicine. 1.3.4 Natural history of disease. By now you have learnt that as long as disease agent, host and environment are in balance of each other, disease does not occur. Every disease starts with sufficient interaction of these factors, i.e., disease starts, it progresses and follows a series of events in its natural way if no treatment is done. This is the whole process of natural history of disease. 1. The prepathogenesis phase. This phase is before the onset of disease in man, it is in the environment. The Disease agent has not yet entered the host, man, but the factors that favor its agent interaction with the human host exist in the environment. Example: poor environmental sanitation, climatic conditions, prevalence of insects, rodents and pests, etc., unhygienic health habits and health behavior, and biological factors i.e., age, sex, marital status and genetic traits, general and specific body resistance, etc. This means that man is always exposed to the risk of disease, i.e., he is in the midst of disease. But the disease process in man starts only when there is interaction among agent, host and environmental factors as shown in Fig. 1.12, Fig. 1.14, Natural History of Disease and Level of Prevention, adapted from K. Park, Textbook of Preventive and Social Medicine. 2. The pathogenesis phase. This phase begins with the entry of the disease agent through appropriate channel in the susceptible human host. Example: entry of chickenpox virus, varicella zoster through the respiratory tract. The agents, i.e., the virus, grows and multiplies and bring about physiological changes in the body. These changes are subclinical, i.e., the clinical signs and symptoms of the disease are absent. The host remains apparently healthy for few days. After a lapse of some period which varies in different diseases, the signs and symptoms begin to appear. This period between entry of agent in host till appearance of signs and symptoms is called incubation period, which is usually 14 to 16 days in chickenpox. In many diseases like in chickenpox, early signs and symptoms may include mild fever, back pain, general malaise, and last for 2 to 3 days before the rash appears. This period is called early pathogenesis phase. But as the disease advances, signs and symptoms become clear. To 1U, disease can be diagnosed. The stage of pathogenesis varies from disease and from individual to individual depending on the strength and number of the causative organism and susceptibility of the human host. The disease process may end into complete recovery, or it may end into some kind of disability, defect, chronic state, or death. In pathogenesis phase 1.3.5 spectrum of disease, from your experience in the community, you must have seen that whenever any disease spreads, all people do not get the disease. Also, all those who get the disease do not suffer with the same severity. Some do not show clinically recognizable signs and symptoms, i.e., remain subclinical but have the infection and can give infection to others. There are others who show clinical, i.e., recognizable signs and symptoms of a disease. This range in severity of illness is comparable to range in shades of colors of sunlight, spectrum beam of sunlight. As shades of colors vary from one end to the other, but it is difficult to say where one color ends and the other begins. Same is true in case of disease spectrum. At one end of the disease are clinical infections which are not identified, and at the other end are fatal illness. In the middle of the spectrum lies illness ranging from mild to severe. Spectrum of disease thus refers to graphic representation of variation in severity of disease. Occurrence 1.3.6 Iceberg of disease. According to this concept, disease in a community may be compared with an iceberg. Floating tip of iceberg represents what doctors see as clinical cases in community and subclinical cases. Doctors and other health workers can diagnose only those cases who are recognizable. Such cases are comparatively very few than those who are unrecognizable. They are carriers and missed cases and remain hidden. These cases are source of infection to others in the community. It is like an iceberg which has a small floating tip, i.e., few clinical cases, which is visible on the surface of water, and a large submerged part in the water which cannot be seen, large number of undiagnosed cases. There is a line of demarcation between pre-symptomatic cases, carriers of disease or missed, and symptomatic cases at the same time and at same place. out of that symptomatic are able to get diagnosed. But a large number of undiagnosed cases are hidden under this line of demarcation, as shown in Fig 1.16. Hence, the name iceberg of disease, which denotes the presence of a small number of known cases and large number of unknown and missed cases. Fig. 1.16, the iceberg of diseases. 1.4, health for all, HFA. In this section we shall discuss about the definition, meaning and strategies of health for all. 1.4.1, definition and meaning of HFA. In May 1977, WHO in its 30th World Health Assembly decided on the attainment of a goal of health for all by 2000 by all the member countries of WHO. HFA has been defined as the attainment of a level of health by all the people that will enable them to lead a socially and economically productive life. The definition of health for all implies positive approach to achieve possible optimum health of people at large. It means that every country and every individual in the world puts in efforts to achieve a level of health which is possible within their strengths, capabilities, and facilities. It means that every person with support of healthcare delivery system tries to promote and protect his health, search medical care on time when sick or invalid, attains a sense of well-being which enables him to work hard, lead useful and contribute towards socio-economic development of self, family, and community society. This implies that times health begins and is nurtured at home, in school and at workplace, i.e., where people live and work. People will aim to practice healthy health habits and lifestyle to promote and protect health, prevent diseases and maintain health. Times need-based affordable and acceptable essential services will be available and accessible to all individuals and families with their full involvement. Times a package of health care services which include health education, nutrition, environmental sanitation, MCH and family welfare services and prevention and control of communicable and non-communicable disease will be provided to all the segments of populations, giving priority to underprivileged section of the society. Times restructuring of health system, reorientation and training of health workers, and learning about change in attitude of people in general and health worker in particular. In order to achieve the goal of HFA, the strategies, principles and targets have been suggested and implemented, which you will learn in subsequent subsections. Thus, HFA does not mean that medical services will be available to all to relieve their sufferings and that no one will be sick or disabled anymore. 1.4.2, Basic Principles, Strategies and Targets of Health for All. In 1978, WHO and UNICEF in their joint international-level conference at Alma, Ata in USSR, endorsed the goal of HFA by 2000 AD. It was further discussed and agreed by all the member countries that primary health care will be the big strategy to attain this goal. In order to achieve the goal of HFA through primary health care, the following principles, strategies and targets were recommended by Alma Ata Conference and communicated by WHO. Basic Principles of Health for All. Times health is a fundamental human right and should be achieved by all human beings. Times the governments should be responsible for the health of their people. Times the governments and health personnel should provide community health information to their people. Times countries must become self-reliant in health matters. Times there should be equitable coverage of all the population. Times preference should be given to underprivileged and vulnerable groups of population. Times the people must participate in planning and implementation of their health care. Times the health services should be comprehensive but emphasis should be given to preventive and promotive services. Strategies of Health for All. Strategies are broad line of actions or directions which are based on basic principles. Times ensuring political and budget support. Times formulation of relevant health policy as part of socio-economic development policy. Times restructuring of health care delivery system with primary health care as integral part. Times defining health objectives. setting the measurable targets, times prioritizing of health activities, times developing mechanism for intersectoral support system, times ensuring community participation and mobilizing public support, times adequate health legislation, times monitoring and evaluation of health acre services. These strategies have helped each country to develop their own strategies and detailed health plans to be implemented. In order to achieve health for all goal through primary health care, it is necessary to have some measurements which would help to determine the extent of achievements. For this purpose, some global targets have been outlined by WHO. These are listed below. Targets: I. All people in every country will have ready access at least to essential health care and to first-level referral facilities. 2. All people will be actively involved in caring for themselves and their families, as far as they can, and in community action for health. 3. Communities throughout the world will share with governments responsibility for the health care of their members. 4. All government will assume overall responsibility for the health of their people. Safe drinking water and sanitation will be available to all people. 6. All people will be adequately nourished. 7. All children will be immunized against the major infectious diseases of childhood, which all possible ways will be applied to prevent and control communicable, non-communicable diseases and promote mental health through influencing lifestyles and controlling the physical and psychosocial environment. 9. Essential drugs will be made available to all. In order to achieve these global targets, all the member countries developed their own health plans and targets so that health promotion, disease prevention, curative, and rehabilitative services become available to all. As a signatory to the Alma-Ata Declaration in 1978, the Government of India is committed to taking steps to provide HFA to its citizens and develop its own National Strategy 1.4.3 National Strategies of Health for All. The Government of India held a national conference in February 1980 to discuss national strategies and action plan to achieve HFA. In July 1980, Working Group on HFA was appointed by Planning Commission of India to evolve national strategies for implementation of healthcare programs to move towards the goal for HFA. The working group submitted its report in 1981, which was accepted by Government of India on the basis of the report. National Health Policy was formulated by the Ministry of Health and Family Welfare, Government of India in 1982. The National Health Policy, NHP, was approved by Indian Parliament in 1983, which commits the government and people of India to the achievement of HFA. Specific goals in respect of the various indicators to monitor progress towards HFA were laid down, given in Table 1.1 below. However, the goals set by HFA were far from achievement and new goals and targets were set, shown in Table 1.2 next to the indicators. Table 1.1, look at the screen. Infant mortality rate, IMR, crude death rate, crude birth rate, net reproductions rate, maternal mortality rate is the most important indicators to monitor progress towards health for all. The policy lays stress on the preventive, promotive, curative and rehabilitative aspects of health care and on establishing comprehensive primary health care services to reach the population in the remotest area of the country. In the context of the size of the population, the socio-economic development and the existing health status of the people, National Health Policy in India has the following notable elements. 1. A greater awareness of health problems and means to solve these in and by the communities. 2. Supply of safe drinking water and basic sanitation, using technologies that the health can afford. 3. Reduction of existing imbalance in health services by concentrating on rural health infrastructure. 4. Establishment of dynamic health management information system to support health planning and health program implementation. 5. concerted action to combat widespread malnutrition. 6. Provision of legislative support to health protection and promotion. 7. Promotion of alternative methods of health care delivery system and low-cost health technologies. 8. Greater coordination of different system of medicine as homeopathic, Ayurvedic, Unani, etc. The health strategy includes restructuring of the health infrastructure, developing of health manpower, research and development, specific goals for developing health infrastructure and manpower is given below. A. 2. Establish one health subcenter for every 5,000 rural population, 3,000 in tribal and hilly area, with one male and one female health worker. B. To establish one primary health center for every 30,000 population in rural area, 20,000 in hilly and tribal area. C. To establish community health center for 1 lakh population. D. To train traditional birth attendants or dais in each village or 1,000 population. T. Training of various categories of other staff, example multipurpose health workers, Mahila Savastha Sangh, MSS. You will appreciate that goals set in HFA were far from achievement. The achievements in health among the states are given in Table 1.3. The Government of India formulated a new health policy, NHP, 2002 and goals to be achieved by 2015 as per NHP 2002 are given in Table 1.2. Look at the screen. 1.5 Primary health care. Primary health care was found to be a practical approach to make essential services available to all people in an affordable and acceptable way with their active participation. This was decided on the basis of experiences gained in providing basic health care services in many countries in the world for improving health care and health of their people. Thus, to achieve health for all by 2000 AD, primary health care approach was adopted. 11. 1.5.1 Background of primary health care. You have learnt about Health for All goal, which was put forth by WHO in its 30th World Health Assembly in 1977. The resolution stated the main social targets of governments and WHO in the coming decades should be the attainments by all the people of the world by the year 2000 of a level of health that will permit them to lead a socially and economically productive life. In 1978, an international conference in primary health care was held at Alma Ata in USSR to work out the strategy for achieving the goal of HFA. This conference was attended by most of the countries of the world. They all agreed upon the goal of HFA by 2000 AD and adopted primary health care as the key strategy to achieve this goal. 1.5.2 Definition and meaning. Primary health care is defined as essential health care based on practical, scientifically sound and socially acceptable methods and technology, made universally accessible to individuals and families in the community through their full participation at a cost that the community and country can afford to maintain. At every stage of their development and in the spirit of self-reliance and self-determination. If you look at the definition, it has big concepts which are here to understand its full meaning. Essential health care, it means the services which must be rendered to people to satisfy their basic health needs. These essential services will differ from country to country and from time to time in a country depending upon health status and health needs of the people. The Alma Ata Declaration stated that at least essential services should include health education, promotion of food supply and proper nutrition, adequate supply of safe water and basic sanitation, maternal and child health care, family planning, immunization, prevention and control of endemic diseases, appropriate treatment of common disease and injuries and provision of essential drugs. Acceptable methods _D technology. It implies the use of methods, equipments and supplies which are feasible, easily available, technically simple but safe and within the socio-cultural norms of the people, i.e. acceptable by the people. 2. Universally accessible. It implies that services are available to all without any discrimination of caste, creed, race, and gender. It also means that services are reachable to the people without any difficulty due to distance, money, and culture. 3. Full participation of people. This implies that people are not passive receiver of available services. They must actively participate in the planning, implementation, and control of activities for their health. For this, people need to be prepared. 4. Affordable cost. It implies that community and country have resources, i.e., men, money, and material to be able to provide essential services to all. In this context, efforts are put in to improve socio-economic conditions in the country so that resources are developed to provide adequate services both in quality and quantity. Spirit of self-reliance and self-determination. It implies building up self-confidence and trust, self-reliance, and identifying one's own purposes. Objectives, self-determination, about health and self-care. Primary health care thus encourages people to be knowledgeable and develop skills to manage their own health matters as much as possible. Primary health care is thus frontline care, which is focused on people at large in the community settings. It emphasizes need-based essential care, which has major component of preventive and promotive health care. It is an appropriate practical approach because majority of the problems are preventable and curable at the community level with simple, economical, and acceptable technology, methods, techniques, supplies and drugs, and self-efforts of the people with some guidance and supervision of health workers. It encourages participatory approach in which health workers and people work together to achieve their common health goals effectively. It also promotes people's self-confidence, trust and abilities to manage their own health matters. It is thus much more than producing essential health care services. It has social, economic development components. It includes education of people which will not only improve their health knowledge, attitudes and skills but also build up their outlook on socio-economic development. This will result in better health and quality life. 1.5.3 Elements of primary health care. We hope that you have understood the concept and definition of PHC. You may be interested to know what types of services are included under primary health care. The 8 essential elements or components of primary health care which have been also mentioned earlier are I. Education concerning existing health problems and methods of preventing and controlling. 2. Provision of food supply and proper nutrition. 3. An adequate supply of safe drinking water and basic sanitation. 4. Maternal and child health care and family planning. Immunization against major communicable diseases. 6. Prevention and control of locally endemic diseases. 7. Appropriate treatment of common disease and injuries. 8. Provision of essential drugs. We will discuss these elements in details when we shall deal with role of health worker, A&M, in primary health care under Unit 3 of this block. 1.5.4 Principles of primary health care. There are 5 basic principles identified in the primary health care approach. 1. Equitable distribution. 2. Manpower development. 3. Community participation. 4. Multisectoral approach. 5. Appropriate technology. Let's now briefly discuss each of these principles. 1. Equitable distribution. It means that health services must be shared equally by all people, i.e., people rich or poor, rural or urban, must have access to health services. But the experiences and studies have shown that there is unequal distribution of health and family welfare services and also other related services. The services are inaccessible to the majority of rural people and those living in the urban slums. Fig. 1.9. The main aim of PHC is to reduce uneven distribution by shifting the concentration of healthcare system from cities or urban area, where 3/4 of health budget is spent, to the rural area, where 3/4 of people live. and bring the services as nearer to the people as possible. 2. Manpower development. Primary health care aims at mobilizing the human potential of the entire community by making use of available resources. This can only be achieved if the individuals and families accept greater responsibility for their health. Manpower development lay emphasis to ensure that the required personnel of required knowledge, skills, and attitude are available at right time, at right place. It includes both professional and auxiliary health personnel, member of the community, teachers, panchayat leaders and VHG, and supporting staff. All these personnel are to be trained and retrained in order to apply their technical skills to solve health problems as per social needs and cultural practices of the people. 3. Community participation. It is the process by which individuals, families, and communities assume responsibility in promoting their own health and welfare. Universal coverage by primary health care cannot be achieved without the meaningful involvement of local community in planning, implementation and maintenance of health services by utilizing maximum local resources of men, money and materials. One approach that has been tried successfully in India is the use of village health guides, YHG, and trained birth attendants, TBA. They are selected by the local community they trained locally in the delivery of primary health care to the community they belong to. Village health guides and trained days are an essential feature of primary health care in India. By overcoming cultural and communication barriers, they provide health care in ways that are acceptable to the community. Having understood the idea of community participation, you as a member of healthcare system are to motivate the community people to learn and solve their own health problems. You need to explain, advise and provide clear information on health promotion, disease prevention and appropriate referral system. You are to involve the community in the assessment of situation and setting priorities to solve their own health problems. Encourage them to adopt a healthy lifestyle, apply principles of good nutrition and hygiene, and make best use of immunization services and other related health services. 4. Multisectoral coordination. The components of primary health care cannot be provided by health sector alone. The Declaration of Alma-Ata states that primary health care involves, in addition to the health sector, all related sectors, in particular agriculture, animal husbandry, food industry, education, housing, public works, communication and other sector. Agriculture sector ensures the production of food for family consumption. Grow more food and kitchen garden projects are the improved agricultural projects by which the nutritional status of the people can be improved. Similarly, water supply is important for household use. A regular supply of clean water helps to prevent water-borne diseases such as cholera, typhoid, diarrhea, viral hepatitis. Safe disposal of waste and excreta also has a significant influence on health. Insects and rodents-proof houses, properly adapted to local climate and environmental conditions, have a positive impact on health. Certain aspects of public work and communications such as roads to connect people to other villages and health centers, TV and radio communication, for providing information on improved health practices, health programs such as family planning, immunization, growth monitoring, diarrheal diseases, etc., are important in delivery of primary health care services. Education sector plays a vital role in development and operation of PHC. Instructional material literature can be developed and distributed through the education system to teach people on preventive, promotive and certain aspect of health and diseases. Adult literacy program is successfully taken up by education sector. 5. Appropriate technology. Appropriate technology is an important factor for the successful implementation of primary health care. Appropriate technology, i.e., methods, techniques, equipments, and drugs, etc., means that technology, which is simple, locally available, affordable but scientifically sound, culturally acceptable by the people, easily understood and applied by the community health workers and community people. The term appropriate is emphasized because large luxurious hospitals that are totally inappropriate to the local needs are built, which absorb a major part of the national health budget, blocking any improvement in the general health services. This also applies to using costly equipments, procedures, and techniques when cheaper, scientifically valid and acceptable ones are available ways, home confinement using available utensils and fuel to boil, articles and locally available oral rehydration fluids example kanji, lassi, dal sop, nibu pani, coconut water, etc., which are socially acceptable arid financially more feasible. 1.6 Levels of prevention of disease. You have learnt the concept of disease, the natural history of disease, the spectrum of disease and iceberg of disease. Now let us discuss about the prevention of disease at various levels so that it does not occur, and if it occurs it should be early diagnosed and treated to prevent disability and death. Prevention of disease is always better than cure because it helps to promote health, minimize the sufferings and disease, and is economical, does not require sophisticated infrastructure, equipment and material. Above all, it can be practiced by all and everywhere. The levels of prevention have been identified on the basis of natural history of disease and are given in brief as under refer Fig.L.9.1.6.1. Primary prevention. Primary prevention refers to the action taken before the onset of the disease to promote health and prevent the occurrence of disease. These are the measures taken during the prepathogenesis period of disease. Fig. 1.14, which are as follows. A. Health promotion. Health promotive actions are cost-effective intervention, which include safe and healthy environment, adequate and balanced diet, healthy lifestyle, and improvement of the socio-economic and cultural status of the family. Health promotive measures help to reduce the morbidity and mortality due to communicable diseases like tuberculosis, malaria, leprosy, diarrhea, dysentery and cholera, etc. B. Specific protection. Health promotive measures are also useful in prevention of chronic and non-communicable diseases such as specific protective actions protect from particular diseases. For example, some of the immunizations which protect the children against specific diseases such as BCG from tuberculosis, DPT from diphtheria, pertussis and tetanus, OPV against polio, and iron supplements against anemia. Another example could be increase or decrease of specific nutrient in the diet, that is iron-rich diet, and iron tablets in prevention of anemia. Primary level prevention has been given a major emphasis in primary health care, and it is responsibility of all health workers, individuals, groups, families, and community. 1.6.2 Secondary prevention. This level of prevention refers to the actions taken during the pathogenesis period of disease. Fig. 1.14 to control the progress of a disease and prevent complications. Specific interventions are early diagnosis, e.g., case finding, screening tests, and treatment which helps to arrest the progress of disease in man and its spread to other members of the family and community. For example, if a person is diagnosed as having tuberculosis at the earlier stages, he and his contacts are treated. This helps in early recovering and prevents the spread of infection to others in the community. The health programs like National Health Program for Control of Tuberculosis and Prevention from Blindness initiated by the government are usually secondary level of prevention. 1.6.3 Tertiary prevention. This refers to action in the late pathogenesis period. Fig. 1.9 to reduce or limit the disability and help the person to adjust to his permanent impairment and disability. For example, teaching a person with amputated legs to walk with crutches or use artificial limbs and lead a useful and productive life. This basically is rehabilitation of a person physically, mentally, socially, and vocationally. The role of health personnel is to provide knowledge, information, counseling, and guidance to the people requiring help and assistance. 1.7 Summary. In this unit, we have discussed the concept of health and disease. The changing concepts of health are biomedical, ecological, psychosocial, and holistic. The concept of health traditionally means free from disease, and according to WHO definition, health is a state of complete physical, mental, social, and spiritual well-being, and not merely an absence of disease or infirmity. We also discussed about the various dimensions of health. Physical dimension refers to the physical well-being. Mental dimensions relates to the ability of a person to adjust in various situations. Social dimension means the relationship of individual to others. If an individual feels satisfied, experiences happiness in all these dimensions, is said to enjoy positive health. The factors which determine the health of a person are heredity, the effect of genes on physical and physiological and psychosocial characters of an individual, the environment, example physical, biological, and psychosocial, and the lifestyle and level of income and education. We have also learned that healthy and hygienic practices and good environment are also essential for good health. We have also talked about the concept of illness and disease, which is caused by the interaction of agent, host, and environmental factors, but chronic and degenerative diseases are caused by multiple factors related to lifestyle. We have seen that in the absence of interventions, almost all diseases follow a natural course known as the natural history of disease. It has two phases: the prepathogenesis, i.e., before the onset of disease, and another one is pathogenesis, which starts with intervention of agent and host under the favorable environment in the human host. The severity of illness ranges from mild to severe, is known as spectrum of disease. We also talked about the iceberg of disease. In this, majority of the cases remain hidden and undiagnosed, which are a source of infection to other human beings. We discussed various levels of prevention of disease. The primary prevention, to prevent the occurrence of disease with health promotion like healthy lifestyle, good nutrition and environment, etc. And specific protections like immunization of children against communicable disease. The secondary prevention includes early diagnosis and treatment of disease, and tertiary level prevention is to limit the disabilities and help people to adjust to their impairment by physical, psychological, occupational, and vocational rehabilitation and counseling. In this unit, you have studied and learnt about Health for All goal by 2000 AD, its concepts, principles, strategies, and targets, primary health care, its concepts, elements, and principles, and role of health worker in primary health care. You have learnt that HFA goal was adopted by 30th World Health Assembly in 1977 in the background of marked disparities in healthcare facilities and poor health status of millions of people in the world. HFA was considered a positive and feasible approach to attain optimum health, which can help improve socioeconomic status and quality life of people. HFA is based on the principle of health as the right or every individual and responsibility of people and the government to put in efforts, become self-sufficient to promote, protect and maintain health. Various general strategies have been suggested by WHO which can be adopted by various countries. Global targets have also been identified to be achieved by the member countries. All member states, including India, developed their own strategies, targets on the basis of general strategies and targets. India formulated its national health policy and targets in 1983. Primary health care was adopted on a big strategy to achieve the goal of HFA in 1978 by International Conference on Primary Health Care at Alma Ata in USSR. Primary health care is a strategy that may be used to guarantee a minimum level of basic health care for all people. Primary health care emphasizes the development of universally acceptable, affordable, and accessible essential health care services that are community based. It also emphasizes health promotion and health maintenance, self reliance, and community participation. It also emphasized that related sectors should also be involved in it in addition to the health sector. We have also discussed 8 elements of primary health care which were identified during the conference. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.